Hi, this is Hari Prasad. Today we discuss about MRI, magnetic resonance imaging. The magnetic resonance imaging, it is a spectroscope. It is a spectroscopy. The spectroscope is depend on the technology of nuclear magnetic resonance. Nuclear magnetic resonance. So, magnetic resonance imaging, MRI is a spectroscopy. Imaging techniques used in medical settings. It is used in medical settings to provide images. To provide images inside the human body. In our body, scanning by use of MRI scanning. How to use MRI scanning? Because any persons, any human persons, in case any problems, to go to hospital where to identify the exact problem based on the magnetic resonance images. And MRI scanning used a large magnet in this system, in this instrumentations, to use large amount of magnet, radio waves and a computer. These three main materials are used: large magnetic, radio waves and a computer, to create details cross-sectional image of internal organs and structures. Our internal body organs or tissues and any problems, to detect the in the computers, cross-sectional computers, which is print out or films are to provide in a patient. So, the magnetic resonance imaging is mainly purpose is medical field, to identify the abnormal organs. It is identify abnormal organs. Normal organs cannot identify. Normal organs, any abnormal organs to create, to form in our inside the body, which problem is detected by the MRI. So it is called commonly MRI scanning. The MRI scanning first created by Raymond Damanden. Okay, the first MRI scanning. A scanner. MRI is based on the principles of nuclear magnetic resonance, which is a spectroscopic technology. MRI is a spectroscopic technology used to obtain microscopic chemicals and physical data about molecules. Okay, used to obtain microscopic chemicals. In this process, to use microscopic chemicals and physical data. How to functions? Okay, an MRI scanning containing two powerful magnets. It containing two powerful magnets. These are the most important part of the techniques. Okay, the human body is largely made of water molecules. The human body. Our body is created by 70% of water, which are compressed of hydrogen and oxygen atoms. The water molecule is compressed of hydrogen and oxygen. That means the water molecule is nothing but H2O. It contains oxygen and hydrogen. Our body to contain 70% of H2O molecule, nothing but 70% of water. Okay. At the center of each atom, lies an even smaller particles called as proton. Each atom have a proton, one proton. Each atom have some protons have a more number of protons. So the compulsory of the presence of the protons in each atoms, okay, which serves as a magnet and is sensitive to any magnetic field. Normally, the water molecules in the body are randomly arranged. Actually, in our body, the water molecules is nothing but H2O molecules present randomly, cannot present orderly, randomly present in the water molecule in our body. But on enter an MRI scanning, okay, when our body is pushed into MRI scanning instrumentations, the first magnetic causes the water molecules to align in one directions. The random water molecules are to align one directions by the first magnetic. The first, it contains two powerful magnets. First powerful magnet property is to change the molecules order, random molecules order, to convert into only one directions. The one direction is north or south. Okay. The second magnetic purpose is then turned on and off in a series of quick pulses. The second magnetic is on and off characters. With a short time, okay, causes each hydrogen atoms to change its alignment. Actually, hydrogen atoms randomly present. On and off times, the on times, the molecules, hydrogen molecules are to change their position, and off times also to change the original positions, to change another position. That means simple. The second magnetic uses is the hydrogen molecules actually same positions by the first magnetic. The second magnetic, based on the second magnetic purpose, the position is changed. In case the all positions is north side, in the second magnetic off time, which position is changed to south side. Okay, that means the causing each hydrogen atom to change its alignment when switching on, and they quick switch back to into original relaxed state. Okay, when you on positions to change character, on the off position to convert into original position, relaxed positions. Okay, when switched off, the passing electricity through gradient coils, then and also the electricity is passed through the gradient coils, which also cause the coils to vibrate and create the magnetic field. Okay, the vibrate and to create magnetic field because of the to pass of electricity through the gradient coils. Okay, the molecules are vibrated, and to create magnetic field causes in a knocking sound inside the scanner. Okay, you observe, get any patient to go to the hospital, test the MRI scanning. The MRI instrumentations, the full body is push up. Okay, on the scanning process, minimum 5 minutes are taken. On the 5 minutes, the magnetic field created in our body. On the magnetic field creating process, some sounds are produced. There is called knocking sounds. There is called knocking sound. That is, when you magnetic field created because of the apply the electrical field. In case apply the electrical field and magnetic field. In the MRI scanning, to use two fields. One is the magnetic field and electrical field. The magnetic field and electrical field apply in our bodies. Okay, and our body to create internal magnetic field based on the internal magnetic field creations. Okay, to create the structure in a computers. Okay, although the patient cannot feel the changes and the scanner can detect them, and in conjunction with a conjunction with a computer can create details cross-sectional imaging for the radiologist. Okay, on the scanning process, some sounds are produced, but patient cannot feel any changes. The scanner to detect, scan our body in any organs, abnormal organs present in our bodies, to detect and produce the structure in a computer, cross-sectional image in a computer. There is a printout. the basic components of MRI scanning. It is the MRI scanning. Basic components are RF transmitters, RF transmitters, RF coil, magnets, tunnel, switches, TYR switches. There is the patient. Okay, and the gradient coils. There is the gradient coils, and X gradient, Y gradient, Z gradient. Okay, magnetic sheet. There is the magnetic sheet and the RF shield. The MRI scanning is depend on the magnetic field. It is working by the magnetic field, but CT scan is working by the radiations. Okay, so radiations is the effect in the some persons, the women persons, any pregnant ladies. So better than to CT scan is the MRI scanning is the better compared with to X-ray and CT scanning. X-ray and CT scanning are working by the radiations, but MRI scanning is working by the magnetic field. Okay, we are not used radiations frequencies, any radiations. Okay, uses. MRI scanning are anomalous of the brain and spinal cord. It is used, and tumors, different types of tumors. Okay, present in the chest and other. Okay, anomalous in a various part of the body. In any abnormals present in the any part of the body which are detected. Okay, and also breast cancer. Screen for the women who face a high risk of breast cancer. Okay, injuries of abnormalities of the joints and such as the back and neck. So many accident to create any problem in the joints or any part of the joints, and also to injection. And certain types of heart problems, some types of heart problems, disease of the liver and other abnormal organs, Any disease present in the liver and organs which are also detected. The evolution of the pelvis pain in a woman which causes including fibroids and endometriosis. Different types of different types of problems. Some problems find out in our body through the MRI scanning. The next is CT scan. What is CT scan? CT means computerized tomography. The CT scan combines several of X-ray images taken from different angles around our body and uses of computer processing to create cross-sectional images. The CT scan, different MRI scanning. MRI scanning to create magnetic field, electrical field, and internal our body also to create internal magnetic field. So based on the magnetic field to form structures on our body structures. But CT scan is depend on the X-ray radiations, X-ray light, which is not to follow the all type of patients. Some patients cannot take the CT scan because CT scan is working is through the radiations. But CT scan also useful instrumentations compared with the X-ray. X-ray is the simple method, but CT scan is compared with X-ray is the better one of the better process. So how to work CT scan? CT scan is the combination of X-ray images taken from different angles. CT scan is different angles, okay, to different angles around our body, and use computer processing to create cross-sectional images. Cross-sectional images, okay, of the bones, blood vessels, and the soft tissues inside our bodies. Our bones are blood vessels and the soft tissues organs inside the body to find out CT scan images to provide more details of information, okay, than the X-ray, plain X-ray. So it is better than to X-ray, but more better is the MRI scan. CT scan can produce detailed images of the many structures inside of the body, including the internal organs, blood vessels, and bones. They can be used to diagnose conditions including damage to the bones, injuries to the internal organs, problems with blood flow, stroke, and cancer cells. Different types of cancer cells and stroke, heart stroke, and blood flow problems, any internal organs to detect by CT scan. How do CT scan work? Okay, they use a narrow X-ray beam that circular around part of the human body. The CT scan is rotated to find out human body. Okay, this provides a series of images from many different angles. A computer used this information to create a cross-sectional pictures. Cross-sectional, like one is in a loaf of bread. This 2D dimension scan show a slice of the inside of body. So CT scan working process is based on the X-ray radiations. The CT scan is rotated in our body. Which part are detected? That part around rotated CT scan. The rotation process, the X-ray radiation passed through the human part, then to create different types of angle images. So more number of imagination to produce and to find out exact problem in our body. This process is represented to produce a number of slides. Number of slides provided. The computer scratch this scanner one on top of the other to create detailed images of our bones or blood vessels. Okay, this is the simple diagram of the CT scan. Where CT scan, it is the CT scan mission. This is the CT scan mission. There is the detector of rotations. This is the rotation part. Okay, motorized platform. This is the motorized platform. This is the monitoring. Okay, this is the X-ray source where the X-ray source are passed. The X-ray source are passed through the human bodies. So in case there is rotated, the X-rays pass through our human bodies. Okay, this is the another diagram of the CT scan patient, detector samples, basic position controllers, and high voltage supplies, timing kV and current voltage controllers, and detectometer microcomputers and camera. Okay, you see that, and the last is the printout of the detection of the film. CT scan uses. CT scan can detect the bone and joint problems and the complex of bone fractures. Any fracture on your bones to detect the CT scan, and the tumors, some tumors present in the human body is also detected. If you have any conditions like cancer and heart problems and disease, aphasis and and liver. Any liver problem or cancer and heart problems to detect by CT scan. CT scan can spot in a help doctor see any changes. They show internal injuries and bleeding, such as those causes by a car accident. Any car accident and injured our bleeding over the blood. So it is also to find out the exact problem. They can help locate a tumor, blood clot, tumors and blood clot, or excess fluid or infections, any infections. Doctors use them to guide treatment plans and procedures such as biopsies and surgeries and radiation therapies. In case any high problem present in our body, by testing of CT scan, doctor suggestions to operation surgeries or radiotherapies. Some cancer tumors present in our body, chemotherapy apply the human bodies. Doctors can compare CT scan to find out if certain treatments are working. For example, scan of the tumor over time can show whether it's responding to the chemotherapy or radiations. Some tumors, like a cancer tumors present in our body, doctor suggestion to chemotherapy or radiations. Okay, this is the uses of CT scan. Okay, so in this section, the summary is: what is MRI? What is MRI? How to use of the uses of MRI. At the same time, what is CT scan and the uses of CT scan. So both are the to find out abnormal organs in our body. But MRI is working based on the magnetic field. It is the magnetic field. But the CT scan is based on the X-ray radiations. Okay. So compared to both, better than to MRI scanning any persons. It is find out exact problems. CT scan is also better, but some patients affects the radiations. Okay, thank you.